Imagine having a disease that can make you hear voices in your head and make you see things that are not actually there. I'm sure at least one person in this class has seen a person talking to air. Like they're having a conversation with someone, but no one is actually there. We wonder, who the heck are they talking to? We dismiss them as crazy. But they actually have a disease known as schizophrenia. I am not an expert on this disease, but I have done extensive research from credible websites, periodicals, and books. Today I will share with you the importance of having knowledge of the mental illness schizophrenia. In order to help you understand schizophrenia, I will explain the subtypes, symptoms, and the different treatment options of this disease. Now I'm going to tell you about the subtypes of schizophrenia. There are many different subtypes, but I only have enough time to tell you a few of them. According to the book, Psychology Making Connections, paranoid schizophrenia is a subtype of schizophrenia in which the patient has delusions, false beliefs, that a person or some individuals are plotting against them or members of their family. The majority of people with paranoid schizophrenia may have auditory hallucinations, meaning they hear things that are not real. They may also have delusions of personal grandeur, a false belief that they are much greater and more powerful and influential than they really are. A false belief that they are, Another subtype is catatonic schizophrenia. According to the book, Psychology Making Connections, catatonic schizophrenia is a subtype of schizophrenia that includes extreme behaviors. At one end of the extreme, the patient cannot move or respond. There is a dramatic reduction in activity where virtually all movement stops, as in a catatonic stupor. At the other end of the extreme, they are overexcited or hyperactive. When a person is a catatonic schizophrenic, they are either extremely manic or extremely depressed. Now that I've told you the subtypes, I will move on to the symptoms. Schizophrenia has many symptoms. According to WebMD, some of the symptoms are delusions, which one believes things or ideas that are not true. Hallucinations, which are seeing things or hearing things that are not actually there. Another symptom is disorganized thinking, which is a failure to think straight. The person may not be able to concentrate on one thought for a very long time and may be easily distracted. A person suffering from this disorder may also seem to be agitated easily. They may become angry at things that would not anger the average person. Another symptom of this disorder is social withdrawal. A person will shy away from social activities and would rather spend time alone. The last symptom I will discuss is emotional unresponsiveness, such as having a lack of emotions. For example, their grandfather may have passed away, but they will show no emotions. They should be sad, but they will act otherwise. Now that I have told you the symptoms, I will tell you the treatment options. There are only two types of treatment options for schizophrenic patients. One is medication, and the other is intensive therapy. According to the website Learn About Schizophrenia, antipsychotic drugs are a cornerstone in the management of schizophrenia. They have been available since the mid-1950s, and although antipsychotics do not cure the illness, they greatly reduce the symptoms and allow the patient to function better, have better quality of life, and enjoy an improved outlook. The choice of dosage of medication is individualized and is best done by a physician who is well trained and experienced in treating severe mental illnesses. The other treatment option is intense therapy with a trained psychiatrist. For some patients with acute, which is not being very severe schizophrenia, they've had some success with this option. For the most part, this type of treatment is seldom used. and is usually accompanied by antipsychotic medication. I hope that everyone has learned a few things about schizophrenia. Now everyone should understand the subtypes, symptoms, and treatment options for schizophrenia. Remember that crazy person talking to the air? Well, now you know they are not crazy. They have an actual disease.